Hi, this is Dr. Matthew Weiner from Commerce, Michigan, here to talk to you a little bit about excess skin after weight loss surgery. To dispel a few common myths, I fully will admit that I'm not a plastic surgeon. I don't do surgery for excess skin. However, I have seen at this point really hundreds and hundreds of patients go through the process and can help dispel some myths and give you a little bit of information that may be helpful as you plan for this. The first thing is that excess skin is common with weight loss more than 100 pounds. A lot of people think, well, if you have bariatric surgery because you'll lose it faster, that you're going to have more excess skin. That's really not true. You'll have excess skin whether you lose it on your own or not. And that's a common issue and concern that a lot of patients have who come to see me is, well, what are we going to do with all the skin when it's all said and done? And first of all, and many times it's not as bad as patients think it will be. But what I really say to them is, listen, we got to get this weight off, and no matter what happens, when you get this weight off, you're going to have excess skin. So we're going to cross that bridge when we get to it. But it's not, in my opinion, a reason to not choose bariatric surgery or elect to have elect to try to lose it on your own instead. You're going to have the excess skin either way. So some things that make someone a little more likely to have excess skin are, number one, their age, and number two, whether or not they smoke or have smoked for a prolonged period of time. Smoking decreases the elasticity of the skin. And some people just have more elastic skin than others. So if you already have a lot of wrinkles on your face or are prone to having some wrinkles and some loose skin already, when you lose the weight, it's going to be pretty pronounced. Particularly if you're younger or if you have very elastic skin that kind of has what we call turgor or stands up a little bit or has some tension to it, then you're less likely to need skin surgery afterward. So the question about, do I need excess surgery for skin? I'm frequently asked that by patients. That, I've found, is an extremely personal decision. The idea that you're going to have this skin that's kind of hanging down and interfering with your regular activities like going to the bathroom or getting dressed or putting on clothes or causing constant fungal infections, we certainly do see that, but that's really in patients who've lost 150, 200 or more pounds. For the most part, what I find is that the decision whether or not to have skin removal surgery is very personal, and some patients elect to do it who really, in my opinion, don't have a lot of excess skin, but they've been through a lot, they've changed their lifestyle, they really want their body to fully represent their newfound health, and so they elect to have skin removal surgery for what I would personally consider relatively minor flaccidity of the skin. And other patients will have significant skin looseness and hanging, and in fact they'll say, doc, doesn't bother me. And I say, listen, if it doesn't bother you, it doesn't bother me too. And so really, in the end, this is very much your decision, and there's very few situations where I find a patient where I say, we got to do something about this skin. That's certainly the exception. A lot of patients talk about insurance coverage because this surgery can be expensive. Although the insurance companies will cover some small portion of the skin removal. Most commonly, and every insurance company is a little bit different, but the most common criteria that I find is over 100 pounds of weight loss. They'll cover it, but they really will cover a very limited procedure, just essentially excising the tissue and suturing it back together. And you're left, when doing that, with a pretty poor cosmetic result, with some kind of crooked edges and some things along those lines. And so most plastic surgeons that I've encountered, who really I think are worth investing in and having them do this surgery, are going to typically charge an extra fee for the additional cosmetic components. The insurance will typically only cover the abdomen and will not cover arms and legs. There are exceptions to that rule, but that's been my finding. So again, what I would recommend to you is, if you do plan on having skin surgery, yes, the insurance may cover a component or a small portion of it, but typically you'll have to spend anywhere from, say, $3,000 to $15,000 depending on the plastic surgeon, depending on your insurance coverage, and depending on the extent of the surgery that you elect to have. Thank you very much for your attention. If you have any more questions about weight loss or weight loss surgery, you can check out my website, our Pound of Cure Facebook page, or our YouTube channel.